Hello, my name is Jim Gardner. I'm the Medical Director at Blackpool Teaching Hospitals NHS Foundation Trust. This is my COVID-19 update on Wednesday the 14th of April. Numbers to start with. COVID positive patients on our inpatient beds who are within 14 days of their first diagnosis. That number is 2. I think that's the same number as I reported last week. We have had occasional COVID positive patients coming in through our ED department. There are still people getting poorly with COVID, but the numbers are much smaller. And in terms of the number of patients who are in the hospital because of COVID, but who are no longer thought to be infectious, we've got another 17 now, which is a lower number than last week. 6 are on our general wards, 8 are in Clifton, and 3 are still in critical care, very poorly. So again, a reminder, it's a serious illness. We all know that. Happily, we haven't recorded any new COVID deaths this last week, and I think that's the first time probably since August that I've been able to say that. In terms of community numbers, they appear to be steady and in quite a good place. So Blackpool is showing 13 per 100,000 over the last week, Fylde 22 per 100,000 and Wyre 10 per 100,000. In fairness, I think we expect that we will see some blips in those numbers as lockdowns ease. But if we're all careful, doing the hands, face, space issues that we've talked about so many times, and that if people do get tested when symptomatic, and I've said before there is plenty of testing capacity available, then hopefully we can keep a real lid on those numbers and move satisfactorily into the next waves of lockdown and into the summer. In terms of immunisation, the Trust has immunised over 26,000 patients and staff internally. But as I've said before, the big story really is about immunisation programmes now going on across the community and at the Winter Gardens and so forth. There's been a lot of media attention around side effects of vaccination, and both ourselves and GP colleagues have seen an increase in patients getting in touch about concerns about side effects. I think that's entirely legitimate. I do need to remind colleagues that our accident and emergency department is for accidents and emergencies, and we've been really very, very busy, and the flow through the department is a bit restricted still because of our infection prevention and control measures. So there's a bit of a tension for us there. When the department gets very busy, we get rather worried about maintaining patient safety. So what I would ask is that if you think you've got side effects from the vaccine or any other illnesses which you consider to be important but not critically urgent, that the first thing you do is either ring NHS 111 or get in touch with your GP practice for medical advice. You can of course talk to community pharmacies who are very experienced in many of these situations as well. So thank you for that. Mention about visiting. I mentioned last week that we have been able to ease some of our restrictions on visiting, and they are a bit different depending on where in the hospital you're coming. So I think the easiest advice I can give is please will you have a look on our website if you're coming to visit the hospital, and you'll see how the restrictions are different depending on where you're coming, and particular issues about our accident and emergency department, and then also about visiting up onto the wards. And of course when you do come on site, we'll absolutely insist that you wear one of our surgical face masks and observe our own internal infection prevention and control standards as normal. So thank you for that. So I think the sum up really is we seem to be in a more stable position. The community numbers seem stable. We expect them to go up a wee bit as lockdowns ease. That's to be expected. But if we all do our bit in terms of being careful how we behave and how we interact with others, I think that's our best chance of success. So thank you for sticking with it.